Thank you. I'd like to acknowledge the traditional custodians of the land on which we meet today, the Gadigal people of the Eora Nation, and pay my respects to Elders past and present, and also to extend that respect to any Aboriginal people here today. Just to set the scene a little for you, in 2016, South Eastern Sydney Local Health District was awarded a Cancer Institute grant, thank you, Cancer Institute, to fund a project to increase access to and participation in cervical screening for Bangladeshi and Nepalese women. The Nepalese and Bangladeshi communities are new and emerging communities in South Eastern Sydney Local Health District, and women from these communities have low cervical screening rates and high rates of cervical cancer in their countries of origin. Also, at the commencement of this project, there was no Australian translated information on cervical screening available in either Nepali or in Bangla. My presentation today will focus on the collaboration and co-design strategies that were employed in this multi-agency partnership that included Advanced Diversity Services, which is who is an NGO with links to our target communities, and the Central and Eastern Sydney Primary Health Network. These collaboration and co-design strategies enable us to engage our target groups, which included not only Nepalese and Bangladeshi women, but also primary care providers, and that included GPs, practice nurses, midwives, and child and family health nurses. These strategies also helped us achieve the objectives of this project, which included to increase access to primary care providers who provide culturally responsive cervical screening services, to increase community knowledge and also community conversations about cervical screening, as well as women's participation in cervical screening, and to increase access of the community to culturally appropriate in-language resources that would promote the uptake of screening. Critical to the success of this project was the collaboration on a sister project that was also funded by the Cancer Institute, but was led by the Central and Eastern Sydney Primary Health Network, which facilitated the GP and the primary health care providers' engagement and involvement in the project. The PHN project actually not only covered cervical screening, but covered the 3 national cancer screening programs, so breast and bowel included, and was across 5 LGAs with high call populations. Collaboration with community agencies and community groups occurred through a number of focus groups discussions and stakeholder consultations, and these were led by Bangladeshi and Nepalese community workers. And these consultations brought together the communities with those who have professional expertise in the area of cervical screening. And it allowed us to identify and refine key messages around cancer screening and to develop the culturally responsive in-language resources. And this collaboration with community also enabled open and respectful conversations with large numbers of Bangladeshi and Nepalese community members, which then allowed sensitivities around cancer screening, and particularly around the human papilloma virus and its mode of transmission, to be raised by the community and then to be addressed as part of the project. Also critical to the success of this project was that principle of co-design, or the idea that bringing together those people who are directly impacted by an issue, we develop a shared understanding of what that issue is about, and together we develop solutions and innovations that draw on both the experience and the expertise of all the co-design partners. And as I've said, that included community, but also those with professional expertise in the area of cancer screening, including the Cancer Institute New South Wales program managers. Co-design initiatives that were developed with the GPs and the PHN included the adaptation of our community resources so that they could work in primary care settings and in practices. Also, the development of a clinical leadership training program around cancer screening, and the development of health pathways for cancer screening. Co-design also allowed us to challenge assumptions that were held. For example, it was assumed that it would be best to have separate messages about each of the cancer screening programs, but the community said for them that integrated messages with little clinical details was what they wanted. Most importantly, for sustainability, co-design enabled us to maximise engagement and obtain a high level of cultural acceptability and community ownership of the resources that we produced for the project. In all of our community consultations, we consistently heard that the message that resonated most strongly was that taking care of yourself is the best way of looking after your family. There were other messages that came through as well. The community wanted limited focus on the word cancer because of stigma and fear around that the procedure could be, the screening procedure could be done by a female doctor or a nurse, and that positive messages that related to early detection and successful outcomes were those that were preferred. These messages were then embedded into our co-designed resources, which include a written resource, promoting the 3 national screening programs, and that was co-designed with members of 6 core communities and now been translated into 12 community languages. And also a series of 5 videos in Nepali, Bangla and English promoting cancer screening, and those videos can be accessed through South Eastern Sydney Local Health District's YouTube channel. What I'm going to do is show you a small segment of an edited segment of one of our videos that'll give you an idea about how these co-design messages were embedded into the resources. And thank you guys. Hopefully this works.
If we are sick, who will look after our family?
Looking after our family means also looking after our own health.
If we participate in regular health checks, we have a chance to live a long and healthy life. Participating in cancer screening is a very successful way to stay healthy.
I'd like to share a story about Sultana. Sultana lived with her caring husband and 2 beautiful kids. Because of a regular cervical screening, the doctor was able to identify some abnormality at very early stage. Finding those changes in her body early, she could access early treatment and recovered quickly. As a result, she was able to live a long and happy life, not only with her husband and kids, but also with her grandchildren. Let's talk to each other as friends, because we can support each other.
Screening saves lives.
The scripts for those videos were also developed in partnership with our community workers on the project, and were, if you have a look at them, a little challenging to some of the professionals involved in the project, but we were reassured that the community would find the messages acceptable. So sustainability of this project has been addressed by capacity building at all levels in the community and also with primary health care, the primary health care workforce. A total of 20 GP practices across Central and Eastern Sydney are now engaged in this project through the clinical leadership program and also through consultations. There's been over 90 GPs and practice nurses that have attended CPD training events around cervical screening, and 64 child and family health nurses have also been trained. Sustainability has also been addressed through the ongoing dissemination of the resources. Post-intervention evaluation of this project is currently being undertaken. However, preliminary evaluation results indicate that there's been a high level of community engagement with the co-design initiatives and project-related events. We had over 350 people attend the launch of our resources. And over 90 women have participated in 2 women's health forums that we've held. There's also been a high level of cultural acceptability and ownership of the co-designed resources. The videos to date since April have had about 1,800 views, most of them of the in-language resources, which is quite, the videos, which is quite encouraging. And through the collaboration and co-design strategies employed in this project, we're seeing evidence that Nepalese and Bangladeshi women have been empowered to discuss sensitive women's health issues with their GPs and primary care providers and participate in cervical screening as well as other cancer screening programs. Thank you.
Thank you. Questions? Any questions? No? I have one actually, just in regard to health pathways. I noticed that obviously part of a health pathway development was included. Was that initiative from the outset, or was that something GPs identified as a must in terms of access to this information?
I'm not sure of that, because that was actually part of the Central and Eastern PHN's project.
Requirements,
yeah.
right. Yeah.
So I imagine it was something that was thought about first in that project design and the grant, but
that's
yeah,
right. But just interested, because obviously GP access to that information is something that we all grapple with, and health pathways are becoming a key focus in terms of some of this. Okay, great. Thank you very much.
Thanks.